Now, more in line with infection control, I think it's important for us to talk about skin diseases and disorders. Skin diseases, disorders, and conditions include persons with boils, infected wounds, open sores, abrasions, or weeping dermatological lesions. We should avoid working where there is a likelihood that they could contaminate healthcare supplies, body art equipment, or working surfaces. Workers' skin should be free of rash or an infection, and healthcare workers, tattoo artists, and caregivers should cover any sores with bandages to avoid the potential spread of disease. Let's talk a little bit about the skin anatomy. See, skin is the largest organ of the body, and it contains blood vessels, sensory receptors, nerves, and sweat glands. It's made up of the epidermis and the dermis, and it varies in thickness from 1.5 to about 4 millimeters or more. Skin is the first line defense against infection as long as it's intact. It's made up of the epidermis, the thick outer layer of the tissue that's strong and tough as long as it's intact. The dermis, which is the strong, flexible second layer of connective tissue, that dermis is filled with blood vessels, and any unclean tattooing or body art is at a high risk activity for bloodborne pathogens because it involves multiple punctures of the skin to instill that pigment into the dermis. The hypodermis is just below the skin, and it's the fatty layer, also called the subcutaneous layer. Let's take a look at some commonly spread skin diseases. They include several types, but the first one's going to be in the bacteria group. The first one is Staphylococcus aureus, otherwise known as staph. It's a bacterium commonly found on the skin and in the nose of some individuals. Most of the time, staph really doesn't cause any harm. The infections can look like little tiny pimples or boils or other skin conditions, and most are able to be treated. MRSA, the methicillin-resistant Staphylococcus aureus infection, can look a lot like ordinary skin wounds or a boil or an infected sore. However, the sore doesn't really seem to ever heal, and in fact, sometimes it even looks like it gets worse. People contract MRSA by touching infected mucous membranes, skin, or other contaminated objects. And in the community, most MRSA infections are limited to skin. More severe or potentially life-threatening MRSA infections occur most frequently among patients in healthcare settings. Now let's look at viruses. The most common is herpes simplex. It's generally found on the face, especially the lips, but it can also be seen on the scalp or the arms, the neck, and upper chest. Small round blisters, when broken, they secrete a little clear or yellowish fluid, and that fluid is highly contagious. People contract herpes by touching infected saliva and those other mucous membranes or the skin. And then fungus. The most common of these has several different names for about the same type of fungus, and that's athlete's foot, jock itch, and ringworm. It causes red, patchy, flaky, itchy areas. It's contagious and is easily spread from one person to another. It spreads when infected area on another person or contaminated surface like a shower or the floor of the shower is touched. Affected areas need to be kept clean and dry, and there can be medications to help get rid of that infection once and for all. Some people with the following conditions are more prone to skin disorders. Healing may especially adversely be affected by receiving tattoos or body art. History of hepatitis B or hepatitis C. HIV and AIDS. Diabetes. History of hemophilia or any other blood disorder. History of skin diseases or skin lesions. A history of allergies or adverse reactions to pigments, dyes, latex, etc. Or an immune disorder.